have a look at some of the stress tests that we can do. The posterior stress test that we did in the thoracic spine works as well for the lumbar spine, and there is no change in that technique whatsoever. For the anterior stress test, we're going to do an indirect test. We will stabilize the superior vertebra as we shear the inferior vertebra backwards via the femur. Now, this translates into a relative shear of the superior vertebra anterior. So it is an anterior stress test. Okay, now in order to set this up, for the levels above the lumbosacral junction, that is from L4 up to T12, then we'll have the legs at right angles to the trunk. Now, it's important that as you bring the legs up, you don't allow the spine to flex. So as you flex the hips, just push back through the femur to maintain that normal lordosis in the spine. And then from this position, my hand placement will be such that I will stabilize with most of my fingers like so, and palpate with the index finger. So I'm palpating the movement of the inferior vertebra as I stabilize the superior vertebrae. This hand will come over and assist on the stabilization. So I've just got the one finger palpating for the movement. The force is produced by my pelvis shifting forward. So I'm going to push my pelvis into her. So if I exaggerate it, it's that movement. And this is the stress test now. You simply push through the legs, move up to the next segment, push through the legs and move up to the next segment, push through, and you're feeling whether or not you can feel that the inferior spinous process move backwards. Now, you will pick up some movement in the legs because there's a natural resiliency of the disc to occur, but it shouldn't be enough that you can appreciably feel that movement in your finger. If this test is positive for an instability, it's worthwhile then flexing the pelvis as you flex the hip and repeat the test. Now, what this will do is it will tighten up the posterior ligamentous system, and we'll see now whether this system can be utilized to stabilize this segment in lifting. And just repeat the test now with the spine flexed via the pelvis. If this is now negative, then we know that when we're instructing the patient in lifting or running or anything else, we can tell them to use a pelvic tilt to help stabilize this segment. Vertical stress testing is done again via compression and traction, and for this we'll have the patient laying on their back in this position. I'll just find a pillow for you. Or not, never mind. Are you comfortable? Okay. Now, what we're going to do here is we will basically flex the legs up so that we flex the pelvis. There. And we don't want the lumbar spine in too much flexion, but just enough to flex the pelvis up. And then I'm going to produce an axial compression by pushing through the tibia, like so. And the aim of the exercise is to actually try to move the patient along the bed. You almost certainly won't succeed, but that's the direction of the force there, to produce a compressive force through the spine. For traction, this can be done in much the same position, but you'll have to move to the end of the bed as you do this, coming around this way, and move the patient down towards you. Just stabilize their feet on your thighs, link your hands around the back of the calves, and just lean back, like so. And in both of these tests, we're looking for a reproduction of the patient's symptoms. Okay. Lie on your stomach for me. There's a general torsion stress test that is carried out on the scan examination, where we're looking at the ability of the spine to withstand a pure axial rotation stress. And the general stress for the whole spine is done via fixing T12, taking the ASIS and simply pulling the whole spine backwards, and thereby producing a rotational force through these vertebrae. And to test the other rotation, you would have to come around the other side of the bed and test that. We can also look at segmental rotational testing, where we actually take each segment in turn and see whether that particular segment is unstable. Now, you can pick up an infill from this, and you can pick up excessive movement, but mostly this is used for the reproduction of symptoms. When we're looking at segmental stress testing, we are most certainly looking for end fill and actually any movement that may or may not occur. Just come back onto your side again for me, Beverly. Thank you. So in the same position, just flex the legs up enough so that they stabilise the pelvis. You don't want the lumbar spine in flexion or extension, but just enough to stabilise this area so it doesn't rock all over the place. We'll produce enough rotation through the spine now so that the facet joints will be in a rotated but not locked position. And the advantage of doing this rather than testing in the neutral is that there should be no movement at these segments now at all, instead of the odd 1 degree or so that occurs as a free rotation. So I want to rotate this with neither flexion nor extension, and in order to do that I'll leave the arm laying on the side of the chest, and I'll rotate by pulling this arm, the lower arm, through at about a 45-degree angle from the plane of the bed. And as I'm doing that, I shall be palpating the lumbosacral junction to feel for the movement of that spinous process. Okay. Having got them into this position, now my hand position will be such. I'll put my thumb, or my fingers, whichever you're more comfortable with, on top of the spinous process of the superior vertebra, and my fingers will come underneath the spinous process of the inferior vertebra. Now in this case I'm testing L5 and the sacrum, and the rotation will be a pure axial rotation without allowing any side bending to occur. And as I move up the spine, there should be no movement available. I should get a nice hard end fill as the facet joints on the opposite side impact against each other. So if I'm doing left rotation as I am here, it's the right facet joint that is being compressed. Okay, that completes the stress testing for the lumbar spine. There are special tests that you can do for lateral instability and so forth, but as far as the routine stress testing is concerned, these are the ones you do. So from here we can move into mobility testing. And we're going to look at both symmetrical and asymmetrical mobility testing, and we'll let the symmetrical test lead